Hi, my name is Kitt and I am a counsellor for women and LGBT+ individuals. I'm a member of Counselling Directory and founder of Kitt Therapy. One of the areas I specialise in is working with individuals who've experienced sexual abuse. In this video, we'll explore the topic of sexual abuse, what it is, the impacts it may have on your life, and how counselling may help. Sexual abuse is a very delicate and sensitive matter, which will be handled gently in this video. But if this is a topic that affects you, please take care of yourself after watching this by perhaps connecting with a loved one, making a cup of tea, taking a walk outdoors, or listening to some music. Beginning to look at this sort of topic can really bring up a lot of feelings, emotions, and even body reactions. And really the best advice is to take it slowly and with deep care. Sexual abuse is any sexual act which is unwanted and has not been consented to. It can affect anyone of any age, of any identity. It can happen within families and intimate relationships. In fact, most victims and perpetrators know one another. Consent is a concept that people can struggle to fully understand. So what is it? Consent is when someone agrees by choice to sexual activity. This idea of by choice is really critical. By choice means that the person has the freedom and capacity to make the choice in the first place. A fundamental truth is that a child or minor cannot consent to any type of sexual activity, ever. It is also not consent if the individual fears for their own or another's life or safety, if they're incapacitated through alcohol or drugs, if they've been pressured, bullied, manipulated, or frightened into saying yes. And again, to underline, if the individual is too young or too vulnerable to have the freedom and capacity to make a choice, it is not consent. Sexual abuse isn't always full sex. It can include touching, kissing, exposure, oral sex, or really anything sexual. It can happen online as well as offline. Sexual abuse is a crime that may have a lasting impact on you. It's important to know that you didn't ask for it to happen and you didn't deserve it. All of the blame, all of the responsibility lies with the perpetrator. The effects can be emotional, psychological, and physical. Longer-term impacts of sexual abuse can include personality and behavior changes, sleep and eating issues, low self-esteem, physical illness, depression, anxiety, issues building connection and relationships with others, and post-traumatic stress disorder. Talking to a qualified counselor about abuse you've experienced can be really helpful. It can also feel quite daunting and difficult. Your therapist will be aware of this and will be working to go at the pace that is right for you. There are different approaches to working with sexual abuse, but the initial phase of the work will really be about establishing safety. This will usually look like a slow build of a relationship with your therapist and understanding what safety in the here and now looks like for you. Most trauma-informed practitioners will also incorporate body awareness techniques into the therapy gently. This could look like grounding exercises, working with your breath and different movements, and verbally exploring your relationship with your body. The goal of this strand of work is to bring a felt sense of safety into the body and also to explore what the body may be holding in relation to your experiences. In other words, to begin to understand the language of the body and perhaps to be able to use it as a resource during the work. It's important to know too that contrary to what you may think, it's not necessary to remember or describe in detail what happened to you. The work done in counseling is typically concerned with processing its impact, understanding how the abuse impacts you now, and learning how to cope with and reduce symptoms such as flashbacks. You can expect to identify techniques and exercises for working with the symptoms you're experiencing. For example, if you find yourself easily triggered, you might work through identifying those triggers and plans for either avoiding them or what to do when you encounter them. It may be appropriate to look in greater detail at your childhood and the circumstances that surrounded your abuse as a way of bringing greater clarity and understanding of what happened and how it has impacted you. Doing this work can be challenging, and you should anticipate having sessions that feel stuck, difficult, or tiring. It's really important to build in self-care around your therapy to give you the best possible support. Getting in touch with a counselor, you can expect someone to meet with you on a regular basis for a period of time. Typically that would be weekly, and typically for at least several months. You should feel really deeply listened to and that your counselor is with you, holding your experience. I and other counselors on Counselling Directory offer a safe and confidential space to give you the support you need to cope better with what happened to you, and to create a path forward of growth and confidence, rather than fear and shame. If you are ready to connect with a counselor, please go on to Counselling Directory. You can find counselors who specialize in sexual abuse by searching under abuse. You'll be presented with a list of counselors with expertise and knowledge in this area, and you can reach out to any of us to set up an initial appointment. Wishing you really well.